All right, welcome to the Step Up podcast. The name of this podcast is the Step Up to Strength: Why Physical Therapy After Amputation Can't Be Skipped. My name is Scott Baronic, a certified prosthetist, and I'm here with Nate Capa, certified prosthetist with Bremer Prosthetics.
Yeah, so today we really want to talk about physical therapy, and specifically physical therapy immediately following an amputation. And then after we talk about that, we'll probably get more into talking about how physical therapy even has benefits after the amputation. So, often we see people in our office, immediately following their amputation. We're starting to do an evaluation and, figure out how to design their preparatory prosthesis. And a question that I often have, and I'm sure you hear it all the time too, Scott, is that, why do I need physical therapy? I can just do this on my own. I should be able to just put this on and go. What are your thoughts about that?
Physical therapy is one of the most important parts, or just is, I don't want to say most important parts, but is equally as important as the prosthesis itself. And I think what a lot of people don't realize is from the time that they have that amputation, how the muscle atrophy begins once the inactivity starts, 7 to 8% from the time of surgery.
Right.
So if they have just from that initial surgery, only 8 weeks of inactivity, and usually that starts prior to when they have that the wound. So if they've had a wound for a month or 2 months before that, we could be looking at 4 months.
Right.
But if in an ideal situation they've only had 2 months of inactivity and we get them up on their feet right away, you're still looking at 2 months of inactivity. Some of these people you could be looking at a year.
Right.
So
during that time, the things that we see, or you mentioned the muscle atrophy, and I mean that really just means loss of strength, right? Mm-hmm. As you're sitting there, as your muscles, as they're not being used, your body stops producing the things that need to keep that muscle strong, mm-hmm. right? So those muscles, they get smaller, they get weaker, they lose range of motion. So what happens is the knee gets fixed in a bent position, or the mm-hmm. hip can get contractures. And so that stretching and that strengthening immediately with the prosthesis can be so important, right?
Yes. Yeah, and again, too, that strength is going to be so crucial to balance. Balance equals strength.
Sure, but I mean, so the other things that we're looking at are, when somebody's starting to learn to walk with a prosthesis, it's not a natural movement, is it?
No.
Can you kind of describe, when you first start, what was it like when you first had your amputation and, those first steps? Did you, talk about the age that you were, talk about, your mindset, talk about some of those things. And I'm sure knowing you for this long and trying to imagine what you were like as someone in their young 20s, you thought you were going to put this thing on and run out the door and not look back. I'm imagining.
I was 23 years old and it didn't feel very natural. And a lot of times we can look into these patients' eyes and they kind of have that feeling of, if this is what this is going to feel like for the rest of my life, there's a little bit of feeling of uncertainty. And this is something that they're going to adapt to over time. So there's that kind of reassuring them that as they adapt to this, and a lot of it is what we're talking to, as they develop that strength, they'll get more confidence. And that's, what we're trying to develop here. So kind of reassuring them that as they get that therapy, they build the confidence and they build more strength, that they're going to get more confidence. And that's where they're going to build up.
Sure. How about those first steps that you took? I mean, did they feel natural? Did they look natural?
Not even close.
So,
no.
I mean, those are things we call gait deviations, right?
Yes,
and
yes.
so you're making compensations because of, in that case, as a 23-year-old in a traumatic accident, I'm assuming this happened pretty fast for you. It probably wasn't a long period. You probably didn't lose a lot of strength. You probably didn't lose a lot of range of motion.
I actually lost a lot more than you would think that I did.
Okay.
Yeah. I mean,
Yeah.
I remember looking down at my thigh, and my thigh on my left side wasn't much bigger than my bicep, actually.
Okay.
And it was, now for me, I had a broken femur, so I was probably about 4 months post-operative,
Okay.
where a lot of people you would think within 2 months they would probably be up, and I was about 4, but still, it happened a lot quicker than you would think
Sure.
that it did. So
Sure. And then how about like falls or fear of falling?
Well, I did fall twice before I had gotten the prosthesis. So, I mean, it's a very real thing. I mean, even when you're younger, I always kind of have a joke and say, like, now at my age, I say, I don't have any bounce. And when you're younger, you always had some bounce to you, right? But yeah, it's, the problem with falling is once you have a fall, it affects your confidence.
Sure.
And then we naturally go into a state of, we want to prevent ourselves from falling, so we brace ourselves and we pick up these gait deviations because we just subconsciously we go into a state of we're going to do things where we're going to prevent ourselves from falling.
Self-protection, right?
We're going to shift our weight over to our sound side because we're going to do things to prevent ourselves from falling. So we're going to subconsciously slip into where we're going to walk into more unnatural type ways. And then physical therapy is going to be a great way where we have someone to help coach us and to guide us so that we're going to, correct those things as we, try to.
So, knowing you for so long and knowing your story, you've told me several times, how important physical therapy was for you. Can you explain your process through physical therapy, how that kind of shaped and how it was unique? What was different about how you got physical therapy than what the traditional physical therapy system might look?
Well, my journey was a little different in a couple of different ways. One of them was I didn't really have insurance. So ironically, as a result of that, I had gotten more physical therapy. The gentleman who was helping me, Jim, he owned his own physical therapy place, and I went to him. And when I found out that I wasn't going to have insurance coverage, and I said, I told him that I wasn't going to have insurance coverage anymore, and he said, "What I'm going to do for you now is going to affect the quality of the rest of your life." And I said, "You're not listening to me. I don't have coverage." And he said, "No, I'm gonna do this for you." And I said to him that I would pay him back, and I didn't really realize how expensive those costs were as a 23-year-old kid. But I continued to go to therapy, and so after about 7 months of therapy, which I didn't realize at the time, they have limited benefits where they wouldn't even usually get 2 months worth of physical therapy. But I felt that I wasn't really making the kind of progress that I should make, but I didn't really realize how long this process would be. You and I have things where we talk about now time processes because I was able to reflect, after a period of time, like what that process was like and how long that recovery period should be. But as someone going through the process, I had no idea what that time would be like or how long that should be. I was walking with a cane. I thought I should be walking without a cane.
Sure.
I was trying to go back to work, so I thought I don't have time to do this. And those are things we hear from our patients all the time.
Absolutely.
So I quit going to therapy, and that was 7 months post-op, from the post-op, from the surgery. And about 11 months post-op, I was walking without a cane, but I had a terrible limp, terrible gait deviation. And, it was funny because I always tell people I thought I didn't look cool walking with a cane.
Sure.
Then when I was walking like this, I was like, well, this doesn't look cool at all. So fortunately, I made the smart decision to go back to physical therapy. And after about another 6 or 7 months of physical therapy, people who see me walk now, it's when I see patients, I say, what do you want to get out of this experience? And they say, I want to walk like you.
Right.
So, had I not went back to physical therapy, what we see oftentimes is they end up walking with these gait deviations, and I was able to correct mine. But, if you don't do it in the right amount of time, it's hard to make those corrections. So.
Right. And I mean, I think, the idea is that it remained up to you to correct those gait deviations, right? Like it was still your responsibility to do that, but by kind of having that other person who is an expert in that to help you learn what to strengthen, learn how to coordinate your movements, learn how to do those things, that just had to be invaluable.
It did, yes. I mean, it was the type of thing, there were a lot of times where he was cueing me about shifting weight over here and firing these muscles. And again, like when you asked me early on, like, what was it like the first time you stood on a preparatory prosthesis? And again, we always talk about what it's like when we're looking at the patient, we're like, transfer your weight over there. And they kind of have that look and they'll say, I am doing that, shift your weight over. We always have these mirrors in the gait room and they say, I am doing that. And what we don't realize is how unnatural it feels to them. They feel like they're doing something and they're not shifting their weight over there.
Right.
I remember one of the things he was always telling me about firing my extensor muscles or firing my calf inside of the socket. And when I was in the VA hospital, I started working in prosthetics at the time. And the first time I felt myself firing that muscle inside of the prosthetic socket, I wanted to go to Al and say, hey, I felt it. Because from that point in time, I could fire that muscle whenever I wanted. And that was when the door opened to where I could walk naturally and do that anytime that I wanted. And then the muscles started to strengthen. And then, that was the gateway to me walking more natural and doing what I'm doing now. But it took, almost 14 months for me to get to that point.
Right. So that kind of brings us to the point of, what are the problems with the current models in physical therapy? And I mean, one thing that I see is that often patients only get a very short amount of time for physical therapy, and that physical therapy, and this isn't to be, to talk negatively about physical therapists or to, have any, cast aspersions in any way. But they really receive only limited, or what we could maybe even think of as a generic type of physical therapy where, that they, just because of the system that we work in, that, hitting these milestone goals are so important to maintain physical therapy coverage, that oftentimes people get to a point where they can stand, use a walker to walk a short distance, and then they're told that they graduate, that they're finished. Is that an experience that you see?
I mean, yeah, getting these patients to a functional level where, I mean, they have minimal time. I mean, if we're talking about where it took me 14 months, and if, granted I missed 4 of those months, you subtract that, if that's 10 months worth of physical therapy, that's a long time. And these patients, if they're getting 2 months worth of physical therapy, that's not going to get them to that point. And the Step Up program, which we haven't begun to talk about, but that's kind of how to address and get these people back to physical therapy when they qualify, so they can maybe get some of these things in advance, and get some of the more additional things to function at a higher level.
Right. And I mean, with one of the things that we often see is that insurance restrictions are cutting physical therapy short, right?
Yes.
I want to be real blunt about this.
Yes.
That this isn't us saying that physical therapists aren't doing their job or aren't doing enough.
Correct.
What we're saying is that insurances in this country are not allowing physical therapists to do the job that they know they need to do.
Correct.
Your physical therapist said, hey, I'm not bound by the insurance system anymore. Now you can get real coverage. We can do what you really need.
Correct.
I mean, we see this, with standard of care that's set up at like Walter Reed or through the VA, where these benefits they don't have, restrictive caps or limits like we often see with private insurance or even Medicare.
They have unlimited therapy, and therefore they have unlimited test sockets, unlimited prosthetic, and as a result, they function at a higher level.
Right. And so because of these things, we see that a lot of times patients don't even have physical therapy after they get their prosthesis, or the physical therapy that they're getting is through a place that may not have amputee specific training available, or hasn't really seen the things that they need to do. And that, I mean, these things are leaving people unprepared, unsafe, and at a higher risk for injury, or possibly rejecting a prosthesis altogether and saying, this just isn't for me for some reason, when it's probably not the case. It's probably the barriers that are preventing this.
Most definitely. Yeah.
So that brings us, I mean, you kind of alluded to Step Up a little bit.
Yeah.
That brings us to our program, which is the Step Up Amputee Strength Training Program. Why did we do that? What was our rationale for that? What was the driving force? And then more importantly, why have we continued to do this since 2012?
Well, you and I talking about physical therapy like we have, and one of the things that we identified early on was the physical therapy and what happens. We want to get patients to function at their highest level, and we noticed that patients are plateauing where therapy stops.
Right.
And we're realizing that in most cases it takes patients 2 years to function at their highest possible level.
Exactly.
And patients are getting about 2 months worth of physical therapy, and if they're plateauing where the therapy stops, how do we get them so that we can get them to that point where they can function at their highest possible level? So we were really working with them in the office and trying to show them additional exercises and things like that, but that's not really our job. So we knew other physical therapists who kind of showed us different exercises and things like that, and they would work with us different ways, and they were working with us with patients that beyond what their paid visits were and things like that. So we kind of started some exercise programs and things like that, and then we started partnering with the hospitals,
right?
Doing programs in the hospitals, and we thought, hey, if we do this as a program and we're in the hospital and then we have physical therapists there, we thought this would be great, because then these people are in a supervised area, and when there's times when maybe they can only get 2 months worth of physical therapy, but every year they qualify for more therapy.
Right, or if there's a changing condition or things like that, right?
Identify a changing condition, so that when they qualify for more rehab, they can get more rehab. So this way they're still in a structured environment. The main thing that you talked about earlier is they're being coached by these physical therapists.
Right.
So we can still cue them, like you talked about with my therapist. It's like, how important was it that it's like, we only get 3 hours worth of physical therapy in outpatient a week.
Right.
But it's the work we do on our own when they're coaching us and they're saying, hey, Scott, work on this, do that exercise. I would go home and I would do that
Right.
big time. It's
Yep.
like it's like working out at the gym or,
Right. It's like having a personal trainer,
like
right?
having
They're giving you the roadmap, but expecting to get your full benefit out of 3 hours a week. That's not realistic, right?
No.
So it's about them, and the great part about it is that they can continue to evaluate, look at specific exercises that they can kind of diagnose and say, this is where you're at, this is what's going to help you overcome some deficits. And so that's when we really developed Step Up, we did develop it to be a structured strength and conditioning program so that the groups of exercises would continue to challenge people as they got stronger. As they became more mobile, they would get a new group of exercises for their take-home exercises so that they can do that. And I mean, you said it, I want to reiterate it, but it was always designed to complement physical therapy. Never designed to replace physical therapy, never designed to be something that was better than physical therapy.
No.
This is a tool that you can use in conjunction with physical therapy to help expedite the process to getting to where you want to be.
It was just meant to address the void
Right.
or the lack of physical therapy.
Right.
Because they don't get enough of it.
Right. So, and as you said, I mean, we really did this with input from people that were prosthetists, physical therapists, and adaptive athletes. So we used all these programs that people are using, and we kind of distilled it down to say, here are things that you can do to help you continue to improve. And then hopefully go back to physical therapy.
Yes.
So when we did that, we really focused on 3 specific areas for these exercises, if you can remember. And it's core strength, balance, and then just overall strength. And we always said that strength and balance are, they really are.
They do go hand in hand.
They do go hand in hand.
Yep.
But there are specific balance exercises that we can work on that maybe work more on fast twitch type muscles that can help corrections, like if you're on uneven ground or if you take a misstep, versus just physical strength that's going to be slow twitch muscles that are just going to be those like more endurance based things.
What we talk about in that is how we contract the muscles inside of the socket to help control the balance.
Okay.
Right. We work on strength training to specifically strengthen the muscles that we do that. And when we do the balance, we work on contracting specific muscles to work on our balance. And they're different exercises so we can target those. Those muscles in the exercises.
Right.
Core is something, when you and I would talk to physical therapists, they'd say, we'd love to work on core. Core is so important. But again, when they're doing that just to get them to a functional level, they don't have time to work on those types of things. So this gives physical therapists, when they love working in the Step Up program at the hospital, having the time to do these types of things because it gives them an opportunity to do exercises that they don't really get to do in the clinic because they don't have the time. I mean, I remember, back when we were doing these, we were doing yoga.
Right.
We were doing a lot of different things
Absolutely.
that you wouldn't typically see in a physical therapy environment, during those 2-hour Step Up programs. That was actually pretty cool to work on with amputees, and to see them and have the opportunity to do it in an adaptive way. Right.
So I mean that brings up, obviously Step Up was designed to fill in gaps in the physical therapy system right now. And I mean, we mentioned that core strength is one of those gaps that we identified to say that people just aren't getting it, don't have an ability to do this. I think there's some other gaps that we really saw, and I mean, whether it's somebody that's waiting for a prosthesis and the therapists don't really want to use their benefits yet, or people that just finished physical therapy but aren't, don't feel like they're achieving everything that they want to in their day-to-day life, or, what about people that, maybe for one reason or another, life took them in a direction where they weren't active for a while, but all of a sudden circumstances change and they want to refocus on those things.
Right. Well, I mean, having something like an amputation can certainly, that's a life-changing event.
Absolutely.
And that can make you say, hey, you know what, I'm going to prioritize my health. I need to do this. I'm not getting any younger. This is, or just, getting older in general. I mean, when I lost my leg, running was something that I was, I'm a big guy, so I ran before, but I never did distance running. I ran when I did sports.
Sure.
And then, impact on, your residual limb as an amputee, it's one of the most challenging things that you can do. It wasn't until I was 48 years old that I decided to take on distance running for a long period of time. So, we just go through different stages of life, right? Where we say, I'm going to do this now. Or maybe, your kids get older and you have more time to work out or whatever. So just going through different stages of life, we might have more time, or we prioritize different things, whatever the circumstances are. When those opportunities arise, we should all have the opportunities at our fingertips to take advantage of a more active lifestyle.
Right. And I mean, you mentioned that, initially we were doing this partnering with the hospitals. And I mean, and we thought that was a fantastic model. I mean, we really still support that model and think that it's a really strong one. But it obviously was affected by a pandemic and not convening together. And there were some things that happened that were just kind of out of everyone's control. So, I mean, in that time, we made sure that we continued to do these in, controlled environment, in maybe a little bit smaller setting, but also recorded them so that, they could be, so people could see them live, or, they could go back online. So there is a big library of these clinics online that, even though right now we're not doing the in-clinic setting, there's still a big library out there online, through our website, through our Facebook, through the YouTube page, that all can be to go. So these still have inherent value. In the fact that it's all the same exercises, it's all the same things, and there's enough of them for it to be a unique experience to kind of go through and be worthwhile to watch again.
Well, what I remember seeing during the pandemic was, the first thing we saw obviously was we had a few hospitals that we were doing these with, and then there was our clinics were shut down. Physical therapy was shut down. Nobody could go to physical therapy anywhere. And then when things opened up, there was some home therapy, but a lot of people still weren't going to physical therapy. Then the patients that I was seeing at their homes, they were telling me that their physical therapist was coming, and that they were going on YouTube and they were trying to see videos to try to get access to how to do physical therapy for, with prosthetics. And that was when you and I had the idea. It was like, well, then why aren't we doing this stuff?
Exactly.
That's when we started doing our internal clinics so we could get resources online. I think that was very beneficial for a while. And now with some of the other stuff that we're doing, we're just kind of evolving to what our different demands are and resources and, the different things now. So I think it's, we'll get back to doing those clinics too, but we just have different opportunities with different, activities and things like that to reach different people in different settings. And I like the way that we continue to evolve and, reach different people in different ways. So, and like you said, we have those libraries so people can go back and still benefit from the other things that we've done. And we have that history there. So.
And so, I mean, I guess I'd like to kind of maybe start to wrap things up a little bit and just, say how important we really think that physical therapy is, and have the idea that to really plant the seed in everybody's mind that it's not going to be possible to do the things that you want to do without taking the time to do that physical therapy. And maybe that's not even fair to say, but physical therapy is going to be a tool that's going to certainly make this process more streamlined, more efficient, and it's going to happen a lot sooner by investing that time and effort right off the bat, and so that you don't develop bad habits that you then have to come back and correct. You don't develop a fear of falling. You don't get those gait deviations or muscle, atrophy, joint contractures, all these things that take so much extra effort to correct later on. By putting that effort in right off the bat, you're really setting the stage for yourself to succeed with your prosthesis.
I mean, if anything, to put it a different way, we talk about the strength training and the exercises and that type of thing, but think of that physical therapist, you're just educating yourself on how your body works, and you get that training technique. And like anything else, the better understanding you have about your body, the more equipped you're going to be to have that and apply that so that you're going to have a better functioning you with your prosthetic limb. And how is that not going to help you in the journey going forward.
Exactly. So for more information about this, you can go to our website, www.bremerprosthetics.com. Check us out on Facebook or on YouTube. And please feel free to drop a message to us through any of those if you have any questions, or you'd like some more information about the topic, whether it's step up or physical therapy, and we'd love to be an asset for you. Thanks.